Hi, this is Wally Taylor from Texas Integrative Medicine, and I wanted to talk to you about achieving wellness from head to toe by uh, taking care of the effects of indoor toxins on you and your family. I see patients in my practice every day that have sickness related to toxin exposure, symptoms like chronic fatigue, fibromyalgia, and brain fog. And in my practice, the most dramatic toxin that I deal with in my patients is indoor mold toxins or mycotoxins. You know, this is for two reasons. Number one, they're very common, associated with just about any situation where there's been water intrusion into a indoor facility, such as a roof leak or a pipe break or a flood. The other thing is it's very common, and these toxins are extremely lethal. Toxins like gliotoxin and trichothecene toxin, aflatoxin, and ochratoxin. So it's number one of all of the toxins that my patients are dealing with when they present to our office with symptoms of chronic illness. So how do you find out if you've got mold toxins? Well, a lot of people already clearly know because they see the black mold growing in somewhere in the home, or they know about a moisture situation. They can smell a moldy or musty smell in the home. That makes it pretty obvious. But there are often times when then that's not the case, where it's not readily seen or unable to be smelled. Doesn't mean it's not present. One of the simplest things that we do is advise people to get indoor mold plates, which is a little agar plate that they can open up for 60 minutes in their environment, and then close it and seal it off and send it to a place that can evaluate that. We like to use immunolytics from Albuquerque, New Mexico. But for some people that are really sensitive to toxins in the air, they cannot tolerate more than 2 or 3 spores in a 60-minute period. Sometimes we find that the mold spores are originating in the attic or in the subfloor crawl space, and then they're gaining access to the breathable air in the home environment. But it's always important to check for mold toxins. We a lot of times will recommend that patients go ahead and have a certified mold inspector come out and do a good visual inspection of the home and perhaps some air testing to try to find out if there's a need for remediation. One of the things we always find to be very beneficial is for the air to be filtered in a home where we suspect that there might be excess levels of mycotoxins in the air. We like Austin air filters because they're very high quality. The filters last for a long time, and they've been shown in a number of good studies to really help clean the air for people that are very sensitive to it. The other thing that we find to be very beneficial for our patients and is really inexpensive and easy to do, and that's just to do daily or even twice daily nasal saline flushes. We like the NeilMed rinse kits more than the NeilMed neti pots, and just have them use good clean water such as distilled water, buffered salt, flush that nose out once or twice a day. Because these toxins always first seem to stick to the nasal mucous membranes, and then over time they're absorbed into the brain or even go down the back of the throat with the mucus and are subsequently swallowed, where they can lead to more intestinal symptoms and problems. So I'm going to be talking more about some of the other toxins and even answer some further questions about mold toxins. But certainly it's a good idea to think about mold toxins with symptoms of chronic illness, because so many times it seems to be the thing that we have to deal with the most. So have a good day, and if you like this video, please subscribe to the YouTube channel. Please share it with your friends and family, and you'll have a blessed day.